Here is a MRI on 55-year-old male with history of pain in the right shoulder with suspected impingement. What we see on this MRI is I'm not going to talk about the rotator cuff tendons. I'm straight away going to the chief abnormality, which is situated in the scapula away from the articular surface in the lateral aspect of the glenoid. This is quite subtle abnormality unless we really look carefully at this abnormality. This abnormality is much better appreciated on the coronal sequence. So can be described as a fairly well-defined, irregular shaped abnormal signal intensity area situated in the inferolateral aspect of the glenoid of the right scapula, measuring so and so. We can take all three axis measurements. It shows slightly iso-intense signal on T1 with slightly hypointense signal, slightly increased signal intensity on fluid sensitive sequences. Given the location and the characteristics with no evidence of a bone expansion or cortical destruction, features are suggestive of a plasmacytoma or a spectrum of myeloma if there are other lesions elsewhere in the body. Differential would also include a metastasis and lymphoma. Other rare primary bone lesions, such as benign and aggressive lesions, should also be considered in the working diagnosis. So, the next plan in this patient is myeloma screening and to look into the past history of any history of malignancy. It might be also worth considering a nuclear bone scan if the myeloma screen is negative and take it forward from there. In summary, it is very important to look at the bone marrow not only in the humerus and also carefully in the scapula, because scapular lesions can be very easily missed, especially in the clinical history of rotator cuff abnormalities such as impingement.